Hi everyone, I'm Dr. Sherry, Chief Medical Officer of Women's Health at QuickMD. Let's talk about something that can take over your day and completely wreck your night. Hot flashes and night sweats. If you've ever gone from fine to on fire in seconds, or woken up at 2 a.m. drenched in sweat and wide awake, you know how disruptive these symptoms can be. It's said a night without sleep is a day without perspective. In this video, we're going to break down why hot flashes and night sweats happen, what actually triggers them, what treatments work, and how to decide what approach makes sense for you. Because these symptoms are extremely common, they're real, and most importantly, they're treatable. Let's start with why your body is doing this in the first place. Hot flashes and night sweats are what we call vasomotor symptoms. That's just a medical way of saying your blood vessels are reacting too strongly to small changes. At the center of this is a tiny part of the brain called the hypothalamus. Think of it as your internal thermostat. Estrogen helps keep that thermostat stable. When estrogen levels fluctuate or decline, as they do in perimenopause and menopause, the thermostat becomes overly sensitive. Suddenly, your brain thinks you're overheating even when you're not. So it sends out signals to dilate blood vessels, increase sweating, and cool you down fast, and that's a hot flash. Night sweats are the same process, just happening while you're asleep. Some hot flashes and night sweat triggers that I want you to be aware of are things like stress, alcohol, spicy food, warm rooms, and even a heavy blanket. Now, a question I get often from women who are in perimenopause is, why are they worse around my period? And that's because estrogen is fluctuating more dramatically at that time and not steadily declining. It's actually swinging up and down. Another question is, why do some women get them and others don't? Genetics, body composition, stress levels, and how sensitive your hypothalamus is all play a role. Now let's talk about what actually helps. The most effective treatment for hot flashes and night sweats is hormone therapy, specifically estrogen. It works by stabilizing that off-balance thermostat in the brain. For many women, estrogen reduces the frequency, intensity, and duration of hot flashes, often within weeks. Lifestyle changes also matter, but they won't always eliminate hot flashes. Instead, they can absolutely reduce some of the triggers. Helpful strategies include keeping your bedroom cool, dressing in layers, limiting alcohol, managing stress, and avoiding late-night heavy meals. For some women, cutting out caffeine can also help if caffeine is triggering your hot flashes. Regular exercise often helps with overall temperature regulation, sleep quality, and stress, all of which improve symptoms over time. You may be wondering about supplements like black cohosh and if it actually works. The medical evidence has mixed reviews, but some women feel some benefits while many do not. It's important to know that supplements like black cohosh are not well regulated, so the quality will vary depending on the different brands you're using. It's always a good idea to check in with your doctor before taking or adding any supplements into your treatment regimen, as some can affect your treatment plan and other medications you may be taking. So now comes the most important part, choosing the right approach for you and doing it safely. Now, there's no single one best treatment for hot flashes and night sweats. The right choice will certainly depend on how severe your symptoms are, how much they're affecting your sleep and your daily life and your overall health, and your personal comfort with different treatment options. If your symptoms are mild, lifestyle strategy may be enough. If they're moderate or severe, especially if your sleep is disrupted, hormone therapy is often your most effective solution. Hormone therapy is often a good choice if your hot flashes or night sweats are frequent and intense, if you're within 10 years of menopause, and if you don't have medical reasons to avoid estrogen. Estrogen works by stabilizing the brain's temperature control system, which is why it's so effective for vasomotor symptoms. If you still have a uterus, you must add progesterone to your hormone therapy to protect the uterine lining. Now, if estrogen isn't an option, or if you prefer not to use it to treat the hot flashes and night sweats, there are effective non-hormonal treatments available. These include medications that help calm the nervous system and reduce the brain's heat response signals. They may be very helpful when used intentionally at the right dose and with appropriate follow-up. I'm often asked, can I combine hormone therapy with non-hormonal treatments? Often yes, but this should be done with medical guidance from your healthcare provider. Whatever approach you choose, you should check in with a provider always. If symptoms are not improving, if side effects feel unmanageable, and new symptoms appear, adjusting treatment doses is completely normal. Suffering in silence is never an option. Hot flashes and night sweats are one of the most common and annoying symptoms women experience during perimenopause and menopause. They can disrupt sleep, drain energy, and affect how you feel in your body day to day. And the good news is they're treatable. With the right treatment plan, many women feel so much relief and sleep a whole lot better. If you're dealing with these symptoms or exploring treatment options, I hope this video gives you more clarity and confidence in knowing there's treatment around the corner. Thanks for spending this time with me today.